Hi guys, it's your favorite nurse educator, NP Clark, and I'm back with another cup of the morning coffee, a shot of espresso. We're on dose 2. Okay guys, today I'm actually going to read to you some texts that I received from a nurse, and this is probably another one of those just teachable moments. So the nurse says, hey, I received... the patient has, sorry, I'm reading 2 texts at once. The patient has a new diagnosis of thyroid disorder. Her granddaughter stated that in the past she had thyroid surgery, but there's no diagnosis for it. Do you want any new orders? So my response is do a thyroid panel and follow up with endocrinology. But what was the disorder specifically? She replies, that I let the scheduler know to make an endocrinologist appointment. That the granddaughter only stated there was a thyroid disorder, no specifics. My response, did you ask them if she got skinny or if she got fat? Because what we know about thyroid issues is it's going to be one or the other, right? And there could be some blurred lines, but it would be definitely one or the other. What meds was she on, and how did they know she had a thyroid disorder? Her response is her granddaughter just mentioned the fact that she had previously had thyroid surgery and she was not on any meds for thyroid disorder. There's none listed and no diagnosis. So I said, well, did you ask her if she was skinny or if she was fat? And did she have a goiter? You know, like that little bulge in your throat. Does she have that now? So these are things that I'm asking her to try to get more information instead of just giving this patient a diagnosis that may not be applicable at all. So then the nurse says, no, she's skinny now. So of course that's not what I was asking, but that's okay. So I said, so if there's no diagnosis, then why are we going to add a diagnosis before sending her to these other to another appointment and running some labs? So then she replies to me, this was third-party information brought to my attention, and I'm just relaying the message. So what I want to say quickly, because again, this is a shot of espresso, so this is short. However, nurses, this is not how we conduct business as nurses. Third-party information can get us all sued. It can be detrimental to the patient. So what I said to this nurse and what I'm saying to any nurse, before you call the provider with third-party information, there's still assessments that you have to do. And for me, I don't care if you're an LPN or RN, bachelor's degree, triple doctorate, PhD, whatever. Do the assessment. Find out some information. If the patient can talk, interview them. Call this granddaughter back and ask if the patient had a thyroid surgery. Do you see that? If it's a thyroid surgery, you would see something on their neck or throat, correct? Does the patient have a goiter? Ask the patient, were they ever on any medications? Offer a couple of names of the medications. And then ask the granddaughter maybe if she knew when it was or whatever, because again, this is part of your nursing assessment and collection of information. So going forward, make sure that you are assessing your patient and obtaining that collateral information. So this has been MP Clark, your favorite nurse educator, with a shot of espresso on the morning coffee. Thanks.